Cancer Conversations, a Harold Leever Regional Cancer Center podcast discussing all things cancer and giving you information to improve yours or a loved one's cancer journey. Hello and welcome to Leever Cancer Conversations from the Harold Leever Regional Cancer Center. Today we're happy to welcome Dr. Alina Guseynova, a St. Mary's Hospital medical oncologist with offices at the Harold Leever Regional Cancer Center. Today we'll be discussing what to expect at an initial medical oncology consultation. Hello, Dr. Guseynova, you're very welcome.
Hi, how are you? Thank you so much for having me.
Well, let's start by talking about the role of a medical oncologist. What is it that you do?
We specialize in both hematology and medical oncology. So, to start off with hematology, it's the study of blood. So, we focus on both benign and cancerous blood conditions, anemia, leukemia, and then oncology is the study of cancer. So we focus on well-known cancers like breast cancer, prostate cancer. In regards to cancer, we are usually the point providers who coordinate the cancer care for the patient.
Excellent. And how do people find you?
So most of the time, patients come to us with a referral from another physician. For example, patient's primary care physician may refer to us due to an abnormality seen on exam, blood work, or scans. Another common referral would be from a surgeon, for example, who already has made a diagnosis of cancer, perhaps after the surgery, and would like us to evaluate whether or not systemic treatment is needed.
Okay. And what can someone expect during their first consultation with you? Let's talk about a specific example, say a patient with early breast cancer.
The initial consultation is fairly long, and it depends on where in the process the patient is, if the diagnosis has been made, if they've seen other providers. We do start off from the beginning and gather all the information, which is the patient's full medical history, their previous surgeries, family history, etc. Perform a full physical exam. It's really important to understand what the patient knows about the diagnosis so I can help fill in the rest. And if we're talking about breast cancer in this case, we talk a little bit about epidemiology, their staging, the characteristics of their breast cancer.
Great. And what comes next?
I then focus on treatment for early stage breast cancer and we'll discuss the components, which are different for each patient, but usually consists of surgery, radiation, and systemic treatment. As medical oncologists, we order and monitor the systemic treatment, which can consist of hormone therapy, chemotherapy, immunotherapy, or a target therapy.
And what is a target therapy?
A target therapy is if, for example, they have a mutation, we can target that mutation. So we help prevent the cancer from progressing. And obviously, at the end, we spend the time listening to the patient and answering their questions.
And then talk about follow-up.
In the beginning of their cancer diagnosis, we follow the patient pretty closely, usually seeing them 1 to 4 times a year for the first 5 years, in addition to the other breast cancer providers they see. And we're focusing on how they're tolerating their treatments, whether they're taking hormonal therapy or chemotherapy. So in the first year to two, we see them every 3 months. We do blood work, physical exam, and see how they're tolerating their treatments and provide support.
And who else is involved with the treatment plan?
So that's a really good question. Anytime a breast cancer diagnosis is made, we discuss this at our multidisciplinary meeting, which is composed of breast surgeons, pathologists, radiologists, radiation oncologists, and other oncologists. Everyone reviews the imaging, the pathology, and provides their input into what the best next steps are in terms of treating the patient.
That sounds great. And do you have any other thoughts to share?
So with constant research on cancer, we are coming up with more treatment options, especially for breast cancer. We have immunotherapies, which are now incorporated in early and later stages of breast cancer. I will say that genetic testing plays an important role because if you test positive for a BRCA mutation or BRCA mutation, and you're in a later stage, we do have treatment options for you that target that mutation. So it's a constantly evolving field where we're having more treatment options for the patient.
Wonderful. Well, thank you for being with us today and sharing your expertise, and we look forward to talking with you again in the future.
Well, thank you so much for having me.
Be sure to check out our website, leevercancercenter.org, for more great content and new podcasts. Content produced by Leever Cancer Conversations is for the community and is for education purposes only. We do not diagnose, treat, or offer patient advice. Thanks so much for listening.